Hello everyone, welcome to Hornbill TV. My name is Paulami. Today we are at Swagat Hospital with Dr. Dipankar Das, a very renowned cardiologist in Guwahati, Assam. Sir, since we have heard about angiography, what is coronary angiography and who needs angiography?
See, this is a very good question. Angiography is a diagnostic test. It is not an operation, as everybody calls it. It is just a small procedure. In it, we try to see whether there is any blockage in the arteries of the heart, or for that matter, peripheral angiography deals with blockages of other arteries in the body. For example, renal artery. So coming to coronary angiography, it is a procedure, simple procedure, which is done only to see whether there is any blockage in the heart or not. In it, what we do is that a very small tube type of structure is taken from the either mostly from the hand or sometimes from the groin, and we enter the heart, give some medicine, and then we see it inside the cath lab. So whether there is any blockage or not, that can be seen in the angiography. So it is just a diagnostic test. We do angiography. There are certain indications for angiography. For example, if a patient of heart attack comes, we have to do an angiography urgently to clear that blockage. There are certain types of patients who will have chest pain, which we are not sure whether the chest pain is because of blockage or not, or because of any other thing. If by doing ECG, echo or TMT, it is still inconclusive whether the patient has blockage or not, then for diagnosis purposes also we can do an angiography. So basically angiography is for patients who are having chest pain and we suspect it that it may be because of blockage in the heart.
And how safe it is?
Angiography, as I mentioned, it is not an operation. It is just a small procedure. So it is very, very safe. The risk associated with angiography is around 0.01%. So some people can have some swelling around the site from where angiography is done. But basically nowadays with expertise and with so much of volume, even in Guwahati, the angiography has become very, very safe.
Thank you, sir. So, what is actually angioplasty and how safe it is again?
Now, as I mentioned, angiography is a diagnostic test to see that there is blockage or not. If a blockage comes and we confirm it that the chest pain or breathing difficulty is because of that blockage, we need treatment of that block. Now, angioplasty is again same thing as angiography only, but what we do is that through that hollow tube, we now take a wire, we now take a balloon, we inflate or we dilate the stenosis which is there, and then we put a stent. So angioplasty is the treatment of what we found out in angiography. We put stent inside the heart.
Sir, are these facilities available in Swagat Hospital round the clock?
Yes, as I mentioned that we have one of the best cath lab in the entire Guwahati and Northeast. So this facility is also available round the clock at Swagat Hospital. Our cath lab is open 24/7, be it midnight or daytime. Every time any emergency is there, we are ready to serve the people. We are always there for the procedure.
Sir, what is open heart surgery and what cases needs open heart surgery?
Certain diseases are there. For example, if angioplasties are done for not so severe or not for that complex of a lesion. So what happens is that certain type of blockages are there in the heart, be it calcium loaded or diffusely disease. In such cases, stent cannot be placed, or even if stent is placed, there is chances that maybe in future there will be reblockages. So in certain cases, what we need to do is that we send the patient for open surgery. For example, bypass surgery. Bypass surgery is done for those blockages which are very complex and which cannot be usually treated with angioplasties. Also, there are certain congenital heart disease, for example, holes in the heart, which we call as ASD or VSD or PDA, which most of them can be closed by percutaneous technique without opening the heart. But some cases also need open surgery so as to close them. So basically, open heart surgery are for complex, very complex heart diseases which cannot be treated by percutaneous technique.
What new treatment methods are available at Swagat Hospital?
So here what we are doing is that for every case we can do, we are doing IVAS or FFR, which gives us an accuracy of where to place the stent, from how long the stent should be and how big the stent should be. So IVAS facility is there, FFR facility there, calcium cutting technique or a rota ablation or orbital atherectomy, all those facilities are available at Swagat Hospital. Plus, routinely what people do are pacemakers. So what we have here is the conduction system pacing also. We have recently started EP lab also. So once a month we are having EP electrophysiological workshop we are doing, where we are doing radio ablation also frequently. So every new facilities which are available outside the northeast are currently available at Swagat Hospital.
Now, our viewers would like to know why one should come to Swagat Hospital, Guwahati, from the entire Northeast.
So every hospital boasts of having a good cath lab and doing the procedures and every procedures round the clock. What I can assure you at Swagat Hospital is the prompt treatment that we can give. As I mentioned already, that be at whatever time, be at midnight or daytime or any time, what treatment you will get is very prompt. You get admitted today, the procedure is done tomorrow, and by the next day you are being discharged. So the promptness of the treatment you won't be able to get anywhere else. Along with that, we have state-of-the-art cath lab, as I mentioned, plus our ICU backup is very strong. So all this make Swagat eye-catching for cardiac treatment, and hopefully maybe in future will grow more.
Today, I believe all the information, all the knowledges what Sir has shared today was really helpful and informative for all of us, and I'm sure for viewers too. So finally, Sir, do you want to throw any message for our viewers?
Yes, please. World Heart Day is coming on 29 September, so we should all be taking care of our heart. Now, taking care of our heart is very simple actually, but we do not practice. We should eat fresh fruits, fresh vegetables, go for a morning walk, spend at least 1.5 hours, 2 hours for our own health. Because once health is gone, with money it won't come back. So health is wealth, that is the most important thing. At least spare 1 hour or 2 hour minimum for our own health.
So we should eat good and exercise too. Thank you so much, sir, for your valuable time today. And again, it is our immense pleasure to have you here. Thank you so much for watching the third health series of Swagat Hospital, Guwahati, Assam. Kindly contact the following contact number given below for any appointments and queries of Swagat Hospital, Guwahati, Assam.